All right, let's get into this discussion now. So a study done by Occupational Care South Africa has revealed that absenteeism costs the country's economy between 12 billion to 16 billion rand a year. The high number of absenteeism is due to sick notes that are submitted amounting to 15% of employers absent in a day. Dr. Themba Hadebe, Clinical Executive at Bonitas Medical Fund, says the employee health and productivity really do go hand in hand, and he joins us now to unpack this. Dr. Hadebe, good morning to you. I mean, these are astronomical numbers, 12 billion to 16 billion rand a year that the economy is losing as a result of people taking time off work. Do those numbers make sense to you?
Good morning, colleagues. Good morning to your viewers and your listeners, and thank you for inviting me. No, certainly, those numbers definitely do make sense. And in fact, if a more sensitive tool were to be used, you may find that those numbers were actually quite higher. Statistics actually do tell us that absenteeism and also presenteeism in the workplace in South Africa cost the country more than 235 billion rand a year, which is almost about 4.5% of our GDP. So certainly, those numbers are quite worrisome and astounding, and a lot has to be done to make sure that we bring those numbers down as soon as possible.
Okay, because if you look at the numbers, obviously, where you're measuring absenteeism, it certainly makes a lot of sense. But I'm wondering, as an employer, as an employee watching this conversation right now, and I'm wondering, okay, but how do you measure presenteeism? If I want to, improve productivity in my organization, how do I monitor presenteeism? Perhaps we need to start with the definition, right? What is presenteeism?
Certainly, that's a very good question. So just to start with the definition of presenteeism. So presenteeism is when you have employees who are physically at work, but are not productive due to either being ill or unwell due to other stresses that they may have, both in their work life and in their social lives, that then impacts on their ability to be productive in the workplace, therefore impacting ultimately on the bottom line of the organization.
Yeah, that's really quite interesting. And so I want to start with this. As an employer, how do I spot presenteeism?
So with presenteeism, look, there's no hard and fixed symptoms or signs to spot it. But certainly, as I've said, if your employers are not necessarily showing up at work in their best capabilities that they should, a decrease in the productivity in terms of the work they submit, and the efficacy of the duties that they're supposed to be carrying out. Of course, the obvious ones like always being late for work, leaving early, and just generally not being as energetic and as present in the workplace as they should be. Then that should be a flag or a sign that there's a problem in terms of the employee or the employees, and then the employer obviously has to investigate further to see why the issues of productivity are actually happening in the workplace, and how you can obviously solve this issue. Yeah,
it's just interesting because post COVID-19, people started talking about quiet quitting, which I thought was, an interesting term. And people are even talking about resenteeism, right? Being present, but being less productive because you are perhaps, not so happy in the workplace. And that's become quite a term, and it's a difficult thing for small businesses, big businesses to spot. But let's talk about what it is that we can do to prevent some of these things. I mean, we talk a lot about wellness programs in businesses, but are people actually taking those things up?
That's a very good question, colleague. So the starting point of this, as you've correctly said, is the issue of having intentional and very focused wellness programs in the workplace that ensure that they meet the requirements, both physical and more than now than ever, mental wellness requirements of the employees. And this is not only a responsibility from the employee side and, of course, the EAP provider, but also we need the employer and leadership of the organization to definitely come to the party and in collaboration create more effective, more intentional wellness programs that meet the requirements of the employees, both from a physical and a mental wellness perspective, especially now more than ever.
Yeah, I mean, it's a tough thing to, I suppose, to speak to a business owner about, because they immediately think, they see the company possibly bleeding money to wellness programs and don't see why that would be an investment and an important discussion nonetheless. But we need to talk about the options that are then available, particularly if you are running, say, a small to medium enterprise. You need to get your productivity up, and you're concerned that you may be dealing with absenteeism, presenteeism, or resenteeism, which is even harder to spot, I imagine.
Certainly. So I think for the organization or the employer, the most important thing and the most critical thing to be aware of and conscious of is that, in general, healthier employees are more productive in the workplace. If we have healthy, happy employees in the workplace, they certainly will show up more consciously. They will do their best in terms of applying themselves in the workplace. And ultimately, that would affect the bottom line of the organization and, of course, the productivity of the employee that is involved in that case.
Yeah. I see here the cost of mental health-related presenteeism is estimated to cost us 235 billion rand a year. That's just over 4% of GDP. I mean, the numbers are really quite astronomical if you look at it that way. And this is the issues around depression. You know, we need to actually have a bigger conversation about how it presents in the workplace, which is a really difficult thing. But then there's the fear that as an employee, for instance, if you come forward with the information that you may need help, that you may very well be victimized. What do we say to that argument?
There is a very good point that you raise, colleague. And as I've mentioned before, you know, the issue of health and wellness, especially from a mental wellness perspective, is one that unfortunately still is quite a sensitive one. And there's a lot of stigmatization around it. However, as the health fraternity, we do believe that with a lot of awareness, or enough awareness that can be put out there into the market, and of course the support from the employer and organizations under which the employees do work, this stigma certainly can be managed. And of course, as we've said, the employees can feel more safer and more comfortable in coming forward and presenting themselves when they have challenges, so that they actually are supported. What is important to also remember here is that when we are supporting the employee that is involved, we're actually supporting the employee at 3 levels. Number one, you're supporting the employee at a personal level, whereby they will be able to function themselves in their personal capacity and in their physical space and environment. Number two, you're supporting the employee at the level of the organization, the workplace, where they will be able to be very productive. And therefore, the organization or the employer also gets to benefit the rewards of that healthy employee. But very much more importantly, at the level of the country or the society, where you have a very healthy member of society who ultimately then will be able to also assist in decreasing or curbing the issue of burden of disease, which mental wellness is actually definitely driving at the current moment in time, because of the poor or lack of supportive and effective health and wellness programs, especially from a mental wellness perspective.
Yeah, such an important discussion. Thank you so much for speaking to us. We really do appreciate it and hope that employers, certainly employees, have taken heed. Dr. Themba Hadebe, the clinical executive at Bonitas Medical Fund, of course, speaking to us about workplace wellness, something for us all to invest in.